Upon reaching the patient, remove the lid of the AED Plus and turn it on. Follow the reminder pictures, audio and written prompts through each stage of the life support process.
Stay calm.
An LED light indicates which step you should be focusing on.
Check responsiveness. Call for help.
Call an ambulance.
Open airway. Check breathing.
If desired, the lid from the AED Plus can be placed under the patient's shoulders. This will help support and maintain an open airway. However, you should not use the lid as a support if you suspect that the patient has a spinal injury. If the patient is conscious or they are breathing normally, do not continue to use the AED Plus. If you are in doubt, however, continue on and apply the electrodes to the patient. The defibrillation electrodes come in a sealed pack and should be pre-connected to the AED Plus. If they are not pre-connected, the AED Plus will prompt you to plug in the electrodes.
Plug-in cable.
Make sure that the electrode pads connected are appropriate for the victim. Adult pads are labelled CPR D pads. For children under 8 years old or 55 pounds, Zoll's paediatric pads should be used. Attached to the electrodes pack is a first responder kit. This includes a razor, a small towel to dry the patient's skin, and scissors for cutting clothing. A disposable face shield and gloves are also supplied for your protection. The electrodes need to be placed directly onto bare skin. So first remove all clothing covering the patient's chest. Tear open the electrode pack and unfold the electrode pads. The CPR D pads are a one-piece pad designed to be easy to place. Using the sensor's crosshairs to guide you, align the CPR landmark between the patient's nipples and the middle of their breastbone. Press the CPR landmark with your right hand and pull the number 2 tab to peel the protective backing from the electrode. Press the electrode from the centre out to make sure it adheres properly to the patient's skin. Repeat the action on the lower pad, marked with the number 3 tab. If the patient is large, you will need to tear away the lower pad at the perforated line and extend it before pulling the number 3 tab. The pad should be placed on the side chest wall in line with the left armpit. Instructions on the electrode pack remind you how to attach the electrodes to the patient. Once the pads are applied, the AED Plus will automatically analyse the patient. You should not touch the patient at this point, and the AED Plus will remind you of this.
Don't touch patient. Analyzing.
The AED Plus will determine whether or not the patient can be treated using defibrillation. If they can, then the AED Plus will announce,
Shock advised.
It will then warn you not to touch the patient and to press the flashing shock button.
Press flashing shock button.
Maintain a safe distance from the patient and ensure that neither you nor anyone else is touching the patient before you press the shock button.
Shock delivered.
The AED Plus will confirm that a shock has been delivered and then advise you to start performing CPR. After a shock has been delivered or the AED Plus has announced,
No shock advised.
you'll be prompted to start CPR.
Start CPR.
If the patient is not breathing normally at this point, place your hands on the CPR landmark and deliver chest compressions to the patient. After your first few compressions, you will hear beeps from the AED Plus, which are designed to guide you to the recommended rate of 100 compressions per minute. Try to maintain synchronization between the beeps and your chest compressions. Your chest compressions should be between 5 and 6 centimetres deep. These depths are represented by lines on the right-hand side of the LCD display, and the bar indicates the depth of each chest compression. If your compressions are less than 5 centimetres deep,
Push harder.
the AED Plus will prompt you to push harder. In this case, you will need to increase your compression depth. Try to keep the bar between the two indicator lines. When you consistently achieve this, the AED Plus will announce,
Good compressions.
after 30 chest compressions, deliver 2 breaths to the patient before resuming chest compressions. If you stop delivering chest compressions, perhaps to deliver ventilations for instance, and then do not start them promptly,
Continue CPR.
the AED Plus will prompt you to continue CPR. The AED Plus will automatically initiate another analysis of the patient's heart rhythm and prompt you to deliver another shock if required. Continue this cycle of treatment until the patient shows signs of recovery or until professional medical help arrives. If you are treating a child patient under the age of 8 or under a weight of 55 pounds, you must use the pediatric defibrillation electrodes labelled PediPads 2. The AED Plus will recognise that the PediPads are connected and announce,
Pediatric pads.
place the electrodes on the child according to the graphics on the package. The round electrode should be positioned on the chest and the square electrode on the back. Return the child onto their back before following further AED Plus prompts. Real CPR help does not operate when the PediPads are connected, as this is intended for use only with adult victims. CPR delivered should be appropriate to the age and size of the child, as prescribed by current resuscitation guidelines. In some situations, the early stages of the life support process and the call for help may have been carried out before you arrive with the AED Plus. In this instance, you should attach the electrodes to the patient before switching the AED Plus on.
Don't touch patient. Analyzing.
Now when you press the on button, the AED Plus will jump straight to the analysis stage, enabling you to deliver shock and CPR treatment faster.
Don't touch patient. Press flashing shock button. Shock delivered. Start CPR.